Hello, this is Dr. Ruby, and welcome to PRF 720. In this course, we will be studying human movement science. To understand many of the concepts in this course, you will need a base knowledge of anatomy and some of the movement terms that are discussed in moving the human body. If you don't have a good background in that area of study, or if you just need to brush up, I will refer you to the first 5 chapters of your textbook for this course, Kinesiology, the Skeletal System, and, and Muscle Function by Muscolino. If you come across a word during your reading or during the lecture that you do not understand, please stop there and go to your textbook and look up that term so that you can put together the ideas and get the concepts that we're trying to put forth in the course. This course will be less about memorization and more about understanding the concept and the idea that we're trying to use with human movement science. So what is human movement science? It is the study of the integration of the human movement system. It brings together concepts from functional anatomy, functional biomechanics, and motor learning. Functional anatomy is all of the study of length and tension relationships, force-couple relationships, and muscle classifications. So we look at how muscles work together, how different muscles do different jobs, and they do different jobs in different motions. So that's the idea of functional anatomy, and that is part of this whole integrated system of human movement. Another system within human movement is functional biomechanics. This involves the movements of the joints and the bones, and also how the body is affected from outside forces and forces from within. Lastly, motor learning is a big part of human movement, and this is our nervous system. This is how the brain and spinal cord control the muscles. So here in this grid you can see that muscles, joints, and our nervous system all come together to give us what we need for human movement. It brings together the sensor-motor integration and neuromuscular control that we need to perform movement efficiently. Current concepts in movement bring together the idea that optimal alignment and functioning of each component of the kinetic chain, or the human movement system, is of fundamental importance prior to developing a comprehensive fitness, performance enhancement, or rehabilitation program. Optimal neuromuscular control requires that we have normal length-tension relationships, normal force-couple relationships, and normal arthrokinematics. These 3 things come together to give us that optimal sensory-motor integration, that optimal neuromuscular efficiency, and ultimately optimal tissue recovery and optimal movement. If one component of the kinetic chain, or the human movement system, is not functioning optimally, then we can see predictable patterns of dysfunction that develop, and those will then ultimately lead to a cumulative injury cycle. For example, if we have the person who has a pronated foot or a flat foot, we can see that that small change in the foot affects the entire kinetic chain, or everything above that foot. So when we hit the ground, we're not as good at shock absorption. We maybe have a different movement at the ankle, and the tibia is put in a different position. Therefore, the knee moves differently. Therefore, the femur moves differently. Therefore, the hip moves differently. And ultimately, that can affect the pelvis, which can affect the spine. So something as simple as a problem with the foot can actually affect the neck, or the thoracic spine, or the shoulder. So the kinetic chain is something really important to look at and to try to correct each component of it so that we don't see down the road an injury in another area of the body. When we look at human movement dysfunction, we see altered length-tension relationships, altered force-couple relationships, and altered arthrokinematics. So that's the idea that muscles don't work at the right lengths, or they don't work together well. Their relationships are not good. And then we see joint movement not happening correctly. And ultimately this leads to altered sensory motor integration, altered neuromuscular efficiency, and finally altered tissue recovery. So we either see that a person doesn't heal from an injury, or that an injury is caused because of these lack because of the lack of efficiency in other areas of the human movement system. So why the concern? Why can't we just learn anatomy and biomechanics as separate components? Why can't we just memorize an isolated muscle function? Well, the human movement system functions as an interdependent system. I always explain it to my clients that it's like a family. We're all networked together, and if there's a problem in one area of the family, other parts of the family feel it. And ultimately, when we do rehabilitation or we work with a client, we are counseling their human movement system and guiding it and trying to improve its function. So to achieve optimum results from fitness performance and or rehabilitation, the health and fitness professional must understand the concepts and principles of integrating human movement science. We can't just treat one part of the system. I always use the example with my clients of a husband and a wife that maybe aren't getting along. So if we imagine that the husband is the hamstring muscle and the wife is the hip flexor, and the husband and wife, since they're not getting along, the wife seems to feel it is the husband's problem because the hamstring is short. Well, if we send the husband to counseling by himself, even if he is doing something wrong, it's not going to work. She needs to go along too. She needs to realize what's happening in the relationship, what maybe she can do to assist with the relationship. And then if you look on further, if you look at that relationship that's not good between the husband and wife, it is going to affect the children, it's going to affect the grandparents, and those are the other muscles and systems in the body. And clients seem to get this. So that helps them to understand the human movement system. We want them to understand, and you should understand, how the kinetic chain operates as an integrated unit. What do our muscles do when we move in everyday life? Functional movements are multidimensional and multiplanar in nature. It helps to think of them in the planes of movements. So if you don't know these planes, these are reviewed in the first 5 chapters of our textbook, so you can read there. But this diagram will show you the planes of movement of the human body. You see the sagittal plane cuts the body straight through the middle. I always think of these as, it's kind of a disgusting way to think of it, but I think of them as planes of glass that are cutting the body. So any movement that would occur in the sagittal plane would smear the blood on that piece of glass. So if we did shoulder flexion and extension, that happens in that sagittal plane. Now the next plane would be the coronal plane, often also called the frontal plane, and that cuts the body in front and back halves. And again, if we imagine it as a plane of glass that is kind of cutting the body, if we moved in a way that would smear blood on that glass, we would move in the frontal plane. Things like abduction and adduction and side bending are movements in the frontal plane. Then there's the transverse plane, and it's shown here at the waist, but it can cut the body at any level. And in this plane we see rotation, hip rotation, spine rotation, neck rotation, shoulder rotation. They're all occurring in this plane. We also need to see optimum posture. Optimum alignment of each component of the kinetic chain is the cornerstone to any integrated training program. So when we work with a client, we want to make sure that they're in an effective position and they're in the best alignment possible so that they have the best chance at normal, healthy human movement. Length-tension relationships are another thing that we'll discuss with the idea of human movement. When we look at a muscle, there is a length that it lives at and a length that it functions at, a length that is most effective for it. So muscles change length according to the position that we spend most of our time in. So if someone spends a long time in sitting, we may find that their hamstring decides that, well, it really doesn't need all that length, so it'll shorten itself. And unfortunately, when it becomes shortened that way, it may not have the effective pull for other kinds of activities. What we now know is that there is an optimum length at which each muscle can generate its maximum tension. So we want to try to keep those muscles in a healthy length so that they can perform when we need them to. We also look at muscles in a muscle contraction spectrum. They contract eccentrically, isometrically, and concentrically. Now, if you're not familiar with these terms, please look them up in the textbook and review. Remember that eccentric contractions are lengthening contractions, so the muscle is lengthening as it's contracting. Isometric contractions are when the muscle does not change length, and concentric contractions are when the muscle is shortening. These happen in all three planes of motion for all muscles. So therefore, all of our programs that we create for clients must include all of these types of contractions in the program, not just concentric contractions, but also isometric and also eccentric. We're looking for optimal muscle function, and this does require the central nervous system. The central nervous system is designed to select muscles that work together in synergies to complete functional movement patterns. The central nervous system is made up of the brain and the spinal cord, and throughout our lives we build programs of what movements our body does in a regular normal day. So for example, reaching forward with your arm to pick up an item. We do it so many times in our life that it becomes this automatic program that our body does in a certain way. And the brain and the spinal cord get more efficient at activities that you do more often. It's kind of that whole idea of practice makes perfect. And that's usually a positive thing, but clients can practice bad movements that then become what their body remembers. And sometimes what we end up doing is undoing what they've practiced for many years with their training program. Muscles also have force-couple relationships, and this is a lot like what I was telling you with the husband and wife scenario. You know, muscles work synergistically, and they work together sometimes to reduce force and dynamically stabilize, or they work to concentrically produce a force in a motion. So the central nervous system is what controls this. It's designed to optimize the selection of muscles so that we have synergy. We have muscles that work together in a good relationship, the same way that a good marriage or a good family would work together. If you look at the photo here on this slide, it's kind of an example of a situation like this. If you look at the idea of the pelvis moving into an anterior tilt, it's really the combined effort of the erector spinae contracting and the iliopsoas and the rectus femoris contracting as a team to produce that anterior tilt to the pelvis. If any member of the team is not doing their job, another member of the team may have to overwork, and that's when we can see problems. So the body is made up of many, many force couples that are used as synergies to create motion, and we can see these synergies sometimes get a little off, and that's when we start to see cumulative injury occur in the body. So there's many principles within human movement science. We look at things particularly in three areas, the muscle classification system, kinematics, and kinetics. So we'll go through those now. When you look closely at a muscle, we can classify it by what it does. And this doesn't mean that a muscle is always one thing. It can really change its face and be something else in a different situation. So, you know, muscles play different jobs and different roles, and these are the roles that they can play. For example, the first one is agonist. So this is a prime mover. We could think of the idea of flexing our elbow, and the agonist in flexing the elbow would be the bicep. An antagonist is then the muscle that works in the opposite motion of the muscle that's performing the motion. So if we were just looking at that elbow bend again, we would say that the tricep muscles are the antagonists. They generally control the motion, and they keep that bicep in check so that we don't sort of smack ourselves in the face when we go to feed ourselves. They control the motion. Now, synergists are muscles that assist the prime mover during functional movements. So they're a muscle that doesn't do the prime motion all by itself, but it's supposed to help. A good example here is hip extension. So when you take your leg behind you from the hip, the prime mover is your gluteus maximus. But there's an assister for that motion. The assister is the hamstring muscle, and that would be a synergist. It does the same motion as the gluteus maximus, but it is an assister in hip extension. Now there's also stabilizers. These are muscles that support the body during a functional movement so that the prime movers or synergists can work effectively. A good example of a stabilizer is the paraspinals along the back. So if we look at the rector spinae as an example, let's say the client is doing a squat. So if the client did not stabilize with their paraspinals, when they went over for the squat motion, their chest would fall toward the floor and their spine would round because gravity would then be pulling on their spine. So the erector spinae and the other spine extensors work as stabilizers when you're performing a squat. Now there's another classification that is probably not as well known. It's the neutralizers. These are muscles that counteract the unwanted actions of other muscles. Probably the perfect example here is the multifidus. So the multifidus, as you know, goes through the spine, kind of looks like someone were sewing, and it goes through the entire spine, and its action is as a stabilization or a traction kind of force in the spine. And this multifidus turns on to protect us when we're using things like our erector spinae or our iliopsoas muscles that can create a shearing force across the spinal levels. So that multifidus sort of holds those spinal levels together and supports them while these big muscles pull across the spine. So kinematics or kinetics. Kinematics is the branch of mechanics that describes the motion of a body without any regard to the forces or torques that may produce the motion. It is made up of osteokinematics and arthrokinematics. So osteokinematics describes the motion of the bones relative to those three planes of the body that we talked about, and arthrokinematics describes the motion that occurs between the joints where the bones come together. So kinematics just kind of looks at, how do these joints and bones move, and really don't regard any torque or forces that come across the body. Now, kinetics is the study of mechanics that describes the effects of forces on the body. So these are the musculoskeletal forces. These are external forces and internal forces. Things like gravity and ground reaction. And then internal forces like tension, compression, bending, shear, torsion, and combined loading. So kinetics sort of puts that other piece in as to what is actually happening to create the movements that you see in kinematics, or what is happening to make it harder to do those movements. Okay, so that's the end of the first part of our lecture. If you want to go ahead and start the second lecture piece for Module 1.